All right, we're calling this where we got them all straightened out. This meeting and all the meetings of the committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statute so that the citizenry may be aware of the time, place, and agenda of this meeting. Roll call. I think we're all here, right? Who's
No.
Oh, Rob.
All right, is it here?
We need a motion
Make a
to,
motion to
okay.
approve the agenda.
I'll second it.
We have a motion and a second. All in favor, say aye.
Aye.
Those opposed? That passed. Same thing for our previous meeting. Need a motion in a second.
I'll move to that.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Those opposed? Public here. No program this month, so we jump right into general board business.
Yep, so just a few things I wanted to bring to your attention, starting with some of our grant updates. So we're starting to get some information on, changes to some of our pass-through grants. A lot of the grants we received, like in our consolidated contract from the state, are pass-through from federal government to the state, and they pass it down to local government, to local agencies. And we're starting to get some information on some changes on allocations that we received for some of the grants. I'm gonna pull up quick PowerPoint here. So I've listed a few of the grants that we received from the state that are federal pass-through grants. And a few of them, we've already heard that there's likely funding decreasing. And some of them have kind of been tentative. We haven't heard, and some we haven't heard anything about, but there's a new federal spending bill. And there'll be a federal budget coming up. And a few things that we're starting to hear are some changes in some of the allocations. So I've listed most of the ones that are in our state consolidated contract. First one is an immunization grant. So for this last year, we received just over 11,000. Information we're getting from the state is that we're not gonna, we've actually already spent our allocation for the immunization grant. It's 11,000, it goes pretty quick. Two things are happening there. They're gonna change the cycle to match the federal calendar. So it used to be for us, it used to be a calendar year. It used to be January to December. They're gonna change it to June to July. With that change, we wouldn't be getting any new funding until next June of 2026. So right now we can expect no new funding for immunizations for the immunization program until July 2026. And we're pretty confident it's going to be a reduced amount. So don't know what that'll look like yet. Just know that it's probably going to be less than the allocation that we're getting right now. The lead grant, I haven't heard anything on that, so I listed tentatively expect level funding. Prevention, right now still expect level funding for the next grant cycle. The one that's going to be probably our biggest impact right now is going to be our public health emergency preparedness, our FEP grant. The FEP grant was actually started after 9/11, and that was to help support local agencies respond to emergencies and disasters. Our new contract is, we just received information on it and we just received the budget for it. We've had pretty level funding for the last several years, right around just over $50,000. We are going to get about a 28% initial reduction for this next grant cycle. So we're expected to receive 36,351. The state has indicated that there is a possibility that as things get interpreted and sorted out, on the federal, budgets, that is a possibility. We could get that full amount back at some point in the year, but we're not totally sure. And so to start, this is what we can plan, this is what we know we're gonna receive. So that's a pretty good chunk of money for us. That grant has traditionally helped fund half a position, our coordinator position. So that's something we're gonna have to really look at and see what that means for us. And I'll talk a little bit more about that later in the agenda. Another one that's gonna be impacted is the Supplemental Nutrition Assistance Program, SNAP. The piece of that grant that we get is nutrition education. Fit families, if you remember, we did a presentation on fit families a few months ago. We don't know exactly what that's gonna look like. So this last year, we saved over 42,000 for it. But we are expecting a reduction in that grant as well. Again, don't know exactly what that'll look like quite yet. I think we'll find out more about these in the coming months, again, when things kind of get sorted through and interpreted from the federal budget, but we are expecting a reduction in that grant as well. The other grants that we have here is the Title V Maternal Child Health. Tentatively expect level funding for that. Title V reproductive health, tentatively expect level funding for that in WIC. We're not expecting any changes to that right now. And I put tentatively because we don't quite know yet. I think we'll learn more in the coming months, maybe even into the beginning of 2026 before some of these things kind of get sorted out. But that's kind of where we're at. Yeah, go ahead.
Question. Now you said that first one, the immunizations, but are all these funds looking at going from that? You said July to June, right? Probably meant, or you said June to July, but you probably meant July to June.
Yeah, sorry, yeah,
Yeah.
July to June, yeah.
So are all of these looking at doing that same cycle, or you don't know yet?
I'm not sure on that yet. I know immunization was gonna change.
Okay.
Lead is still calendar year. Prevention actually is like a September to, or an October to
Oh,
September.
so they're all
one.
different.
They're all a little bit
Okay,
different,
all right.
yeah.
I was just curious if we're gonna have to wait 6 months to find, you know what I mean?
Yeah,
Start getting these.
the immunization was really interesting because because they are switching to get on that same cycle. And that kind of impacts us for almost like over a year of funding, so that's gonna definitely make some things challenging on that end as well. No, a lot of these, we're talking 11,000, 6,000, 6,000, not huge, but it all adds up for it. So that's what I have right now on some of the changes or potential changes. Which leads me into our next item, which is an environmental health tech position. So that was a position that this body approved last year for this budget year, 2025. Initially, we didn't have a chance to recruit for it or fill it because we had 2 full-time positions that were vacant. Kind of started at the beginning of the year, and I prioritized getting those 2 filled, which we have filled those 2 positions. One thing I've kind of been looking at is the need's still there for that position. We have the work for it. I'm thinking about kind of exploring maybe filling the workload with maybe a position in our current workforce to kind of cross-train and fill in, particularly, with that grant reduction, that can, like I said, that does support like a half of a position. Maybe at least temporarily filling in and cross-training a position that's already in place to cover that environmental health tech position work. And the thing about the environmental health tech position, that position, the work there is funded with revenues from license fees, from lab fees, from contracts that we have. So those are built-in revenue sources that aren't, dependent on grants or levy. And I think that'll help absorb and cover maybe some of the changes from the grants that we are expected to miss, to lose out on. So kind of looking into that, I think what that'll do though, it'll take some work away from that position, and it will go towards environmental health. So we'll lose some program work when we do that. But it does, I think, fill in that gap that we are gonna probably be missing with some of the grant funding that we normally get. So any thoughts or questions on that? I'm kind of curious if you guys had any
So it would
feedback on something like that.
shift the workload to someone that we already have hired. So there wouldn't be a increase to the budget because we're losing the funding.
The interesting pieces about too, like the FEP grant, the work, what their work requirements for that haven't changed. So there's reduced funding, but same expectations.
Yeah.
So we have the same objectives that we've always have to do. And FEP is actually it's a statutory requirement that we provide preparedness in public health.
So basically mandated
Or
and
mandated.
funded.
Figure it out on your own.
Yeah, it's big.
It generates enough, the work that this person will do generates income. Which covers their salary or close to.
It would close to, because what the tech position was designed for was to work in the lab,
Water lab.
do the water lab, collect samples, do the testing, which we charge fees, and we have a contract with the DNR to do, and then support some of our smaller licensing inspections, like a tourist rooming house, provide some tourist rooming house inspections, which we have license fees for. So the work would be mostly covered by revenues that we generate internally, our own revenues. So yeah, it would almost the majority of it would be covered by that.
But, you know, we looked at getting this position. And, you know, and we have it, and now it's like. If you start moving. The workload off of other people that we already have staffed, I mean.
Yeah.
You know, it looks like maybe we didn't need this position to begin with. That's kind of my concern with the, you know, I mean, what's gonna happen with these other people, we gotta cross train. You know, what
Well,
takes priority?
Some of their duties, so the FEP work is, the FEP coordinator piece is done by our community health educator. The other half of that position responsibilities are the community health education. So half of it is FEP, preparedness, and half of it is community education. So we would scale back on probably some of the community health education part, which is working with, which isn't good. It's good. I mean, we don't want to do that. We may have to though. That's like working with coalitions, providing any type of community education in any other type of forums, like I mentioned, coalitions, working with community partners. Does do some of our communications work, which we would not change, you know, our social media, that type of thing. But I think that's probably where we'd have to scale back on that
Scale back.
position. Because we'd have to give some to take the environmental health position. I think right now, my thought is that this would be, to start anyway, would be a temporary solution. Because like I said, we created that position, like you said, we created that position because there's a workload and a need there.
Right. Yeah,
But until the funding shakes out, you have a better understanding.
We'll have a
of
better
funding.
temporary solution where we don't have to do anything else, basically. And when the environmental health tech position was approved, it was actually approved with some levy funding to go with it. I think as a startup anyway, for sure. But that is a position that, like I said before, works off of revenues generated from the lab, from our fees, from our contracts. So I think when we look at the 2023, or at least the rest of this year's budget, for sure, that would support us, making it through this year's budget. Looking at 2026 budget, I think that would, as we budget for things, that would help us in that scenario.
And as we find out some of the grants and some of the other,
Right. And what I'm asking is, because we haven't filled that position, any position that hasn't been filled in 6 months, you have to let HR know, is that a position that you're gonna keep if you're not recruiting for it? And I'd like to let HR know, it's my plan is, yes, we don't want that position eliminated, even though we're not gonna immediately fill it, because I think we're gonna need it.
and again, as our testing water lab. Are we increasing with that? Is that,
Yeah, we are, absolutely. Yeah, just even our baseline, which is our contract with the DNR, with the public. And then just our private samples that come in, those have steadily increased year over year. So we've talked about before, we've added new testing, we can do phosphorus now, we can do total suspended solids, we added nitrate 2 years ago. So the lab is definitely busy, that continues to add.
I think it's the most prudent approach. Until we know, how can we ask for 2026 if we don't know what it will actually cost the taxpayer to from the tax levy for that position? We can't honestly tell anybody that what it's gonna cost, so.
Right. So I think that would probably be at least the temporary approach that will go as we kind of, navigate the changes and some of the funding that we get.
As long as HR knows that we're not eliminating
The position, yeah. So I'll be sending a memo to them on that regard.
everybody else feel the same way.
All right, and then the last item I have is license renewal update, just an update, so. We license over 600 facilities, restaurants, campgrounds, pools. And several other type of food and recreational facilities. The licenses expire on June 30th, we send renewals in May. After June 30th, we send a second renewal for any facilities that haven't renewed their license, and there's a late fee charged. As of yesterday, we still have 40 facilities that have not renewed and have received their second notice of non-renewal. And so the process with that is we'll likely send another, some folks we communicate with, we've been able to get a hold of, but we'll send another communication saying if you're not renewed by end of this month, basically July 31st, you're out of business, cannot operate. If we notice you're operating, you're can potentially get a citation. Citation is double the license fee, so we definitely want to make sure people get a hold of us. This is 40, I'd say it's around average what we have every year. And most, once they realize or for whatever reason, they couldn't pay the license fee by the deadline, they still will try to, every once in a while it does come down to, for whatever reason, operator doesn't want to renew or just ignores everything and they continue to operate. And essentially we'll have to go out there and with sheriff and say, you're not operating anymore. So hopefully we don't get to that point. But it's a possibility. We did have a handful of operators too that paid past the deadline and didn't pay the late fee. So we withhold the license in that case. And we consider late fee part of your license renewal. So they'll still have to pay the late fee to get their license. So just an update on that. I'd say it's about average, but I will say too, you always get updates to folks that said we're not going over, we'll be out of business. And right now, I'd say I'd say the numbers for total licenses are gonna be a little bit less than they were last year. We've had the most licenses we ever had this last license season. I wanna say it was like 640 some. I wanna say right now we've got about 590 renewed. I'd guess we'd probably be around when all said and done. 610, 620, so a little bit fewer businesses operating. So I just wanted to give an update on where we are with that.
Okay, it takes us down to personnel.
No new updates there.
Your report.
And I really don't have anything new for my report, just that's what I'll probably be working on and communicating with and really monitoring is just any of the changes that we see with our grants and navigating, how we handle those.
Supervisor reports. Anybody have anything they want to share? Next meeting, August 27th. We're not sure yet which room we'll be in. But that takes care of all our business, just looking for a motion to adjourn.
Motion.
I second it.
We have a